Hello, I'm going to be talking to you today about the spiritual and pastoral care services that are available at Kettering General Hospital. The particular focus is going to be on the spiritual and pastoral care team who deliver these services here at Kettering. I'm going to be looking at who we are, what we do, and why we do it. And this training is presented by myself, Reverend Mike Corcoran, and I'm a chaplain based here in the spiritual pastoral care team. I don't work alone, I obviously work within a team. There's myself, Neil Tyra, who is our lead chaplain, Joy, who is our other trust chaplain, and also Osman, who is our Muslim trust chaplain. We also have Father Gregory, who is a Roman Catholic chaplain who can be called in. He's not actually based at the hospital, but he can be called in to see patients in need. We also have a number of sessional chaplains. These are experienced faith leaders who have worked in the hospital for many years. They work for the Trust on a voluntary basis, and they very much support our work. We really couldn't do this job without them. And they visit the wards, patients, see relatives, and also talk to staff. And finally, but not least, we have Debbie, who is our admin support, a very important role to play in our busy team. We also have a multi-faith advisory group. These are individuals drawn from the faith communities in the Kettering and Northampton area, and they too can be called into the hospital to provide support to patients with particular faith needs. We can also speak to them and seek advice around ethical issues. So if there's an ethical issue about providing treatment to a patient, and there's an issue about their religious practices that might impinge upon that treatment, we can consult with these individuals and find the best way forward for the patient. Just moving on, we have a number of quiet spaces which we manage in the hospital. These are available to everybody who visits the hospital or works in the hospital or is in the hospital for treatment of any kind. It's available for anybody of all faiths or none. So we have a chapel, which is based near the main entrance, and we also have a prayer room, which is an outside location between the zone and the treatment centre. As I said, these spaces are available for anybody. The hospital is a very busy, noisy environment, so people can avail themselves of this space, which can provide just that calm environment for them to gather their thoughts during a busy day. This slide here is focusing on introducing the theme of spiritual, pastoral, and religious care. And when I talk to people about this type of care, as a type of icebreaker, I usually get them to imagine that they've been sent to a desert island. Their food and their shelter has been provided for, but they can only take 3 objects with them. And I ask the question, which objects would you take and why would you take them? Now, this exercise helps us to think about the things that are really important to us, objects that link us to our loved ones, our memories, our beliefs. They make us feel human, they make us feel special. And patients will have these things important to them too, and these can become much more important when they're in hospital. And it may be in your work that you will be asked by patients to help unpack some of these things from the maybe the small bag that they bring in with them to hospital, maybe a photograph, a diary, a mobile phone, something like that that is important to them. Or you might be speaking to a relative on behalf of the patient to make sure that some of these things are brought into hospital, because these things can make the patient feel settled whilst they're in the hospital environment. So things that are important to us can conjure up feelings around identity, belonging, beliefs, values, and growth of the human spirit. They can give us hope and they can give us peace, and they can be said to meet our spiritual needs. Now, although spirituality is hard to define, we can sense its absence when it's not there. And many healthcare professionals understand that meeting spiritual needs is important, but they're also unsure about how to go about having these conversations. We at Chaplaincy can help staff understand what spiritual, pastoral, and religious care might look like and give advice about how to provide this type of care. There's a little link here on this slide for a YouTube video of a health professional based in Huddersfield who talks a bit more about spirituality in healthcare. So do have a look at that if you have the time. In Chaplaincy, we support patients, relatives and staff in thinking about their spiritual needs by offering spiritual care following an assessment. Assessment is usually a conversation with somebody which involves listening and possibly taking notes and then considering what's the appropriate action to take. When people are very ill or under stress, it can cause them or their relatives to review their lives and for them to ask the big questions: what's life all about, or why this is happening to me? Now, we don't necessarily know the answer to these big questions, but we can explore the possibilities together. Spirituality isn't just about a person's faith or religion, although there is some crossover there. It focuses more on what gives a person hope, meaning, and purpose. And tapping into our spirituality can give us the ability to cope with some of the difficulties that life presents us with. Having conversations about what gives a patient hope, meaning, and purpose can improve patient care. Now, pastoral care, we can support people with pastoral care by helping them through moments of crisis or change. For example, coming to terms with a diagnosis or the fears of being lonely when they go home. And we do this by offering a listening ear or signposting to other forms of support. Now, finally, but not least, we provide religious care, which is around meeting the religious needs of people. And this is very important for people from different cultural backgrounds and especially people from the older generation. This may include prayer, which is common for people of most faith backgrounds, or religious rites such as Holy Communion. Some faiths also have dietary requirements which need to be observed. It's important for you to get to know the religious background of the patient in your care. End of life support is something that we provide as a matter of course in the hospital. We provide 24-hour on-call service to those who are coming towards the end of their life. So please always ask a patient or one of their relatives in such circumstances if they'd like any support from us. There'll be different rituals for people from different faith backgrounds to consider. For example, prompt burial of Jewish or Muslim patients who have died. And a multi-faith resource pack is available on KNET. We also have a bereavement support booklet, which provides lots of practical support for relatives. Now, most religious people will want some form of prayer at the end of their lives, and the more religious they are, the more it will be important to them. And an important point here is that we can also pray for the deceased at the bedside if the family would like us to do so. Roman Catholic patients and their family may only want a Catholic priest to give them the last rites. This sometimes involves Holy Communion or anointing with oil. Some, however, will accept the support from another Christian faith leader. It may be in the course of your work that you have to break difficult news to a patient or a relative or support a colleague in doing this. Now, having honest conversations allow patients or relatives to make informed choices about healthcare decisions. Discovering a lack of honesty can lead to a breakdown in trust. And here are some useful tips if you need to have a difficult conversation with someone. So it's a simple A, B, C, D, E. So A stands for advanced preparation, making time and space to have that conversation, maybe in a relative's room, or making sure the curtains are drawn around the patient's bed. Obtain all the facts from others in the medical team, and prepare what you're going to say to the person you're going to be speaking to. Start by building up a relationship of trust, introducing the conversation with maybe, I'm sorry, but I have some bad news to share with you. Or maybe, I understand that you're going to find this difficult to hear, but I do need to have a conversation with you about X, Y, and Z. Communicate well, listen, and avoid any jargon. Using those listening skills is very important, showing that you are actively listening. Deal with reactions and responses, so be empathetic, don't judge. Phrases such as you should, you ought, aren't really helpful in a situation like this. Offer encouragement, offer realistic hope, and explore what the news might mean to the person hearing it. So ask questions. It may be that you'll have to go back and see the individual again, because taking in bad news doesn't necessarily automatically happen straight away. It takes time for difficult information to sink in, and people might want to see you again to confirm some facts or details that they weren't really sure about, or they weren't really hearing when you first spoke to them. At Chaplaincy, we recognise that, particularly in urgent care, you're working in a very stressful, demanding environment. You're dealing with people coming to the end of life. So it's important for you to look after yourselves. And I would say that this would include understanding your own story, what gives you hope and meaning and purpose in your role, remembering your role boundaries, what you're there to do, and maybe how others could help you to do your job. Debrief with colleagues if required after a difficult situation or an encounter. Teamwork is important, seeking the help from other teams, such as ourselves in spiritual and pastoral care. And engaging in reflective practice. What can we learn for next time? What could we do differently? I'd encourage you to engage in training and, if possible, any quiet days that you might be able to organise. These might not be possible for your team to arrange, but they are invaluable situations where a team actually goes off-site for half a day or a day just to reflect on its purpose and its performance. Do engage in your annual reviews with your line managers, and also engage where possible in supervision. So sitting down with a colleague who might be a mentor to you to help you to be able to reflect on your practice, the things that have gone well and the things that you could learn from. This slide here asks, why do we need chaplaincy services? Why are spiritual, pastoral and religious support services important, and why does the NHS fund such services up and down the country? And how is spirituality related to health? Well, no one's really sure about that, the answer to that question, but it seems that body, mind and spirit are connected. And the poor health in one of these areas can affect the other. Holistic care for the whole person is not just is for the whole person and not just for particular aspects of the person. And research in the last 10 to 15 years has shown that positive beliefs, comfort, meditation, prayer, and the membership of a supportive community can all contribute to health and well-being. Focusing on your spiritual health may not cure your physical problems, but it may make you feel better and help you cope with illness, the loss or death of a loved one. Spiritual care is a key aspect of the NHS's offer, and it's mentioned in our hospital contract and is looked at by the CQC, especially end-of-life care, when reviews are carried out. So, in summary, this is what the spiritual and pastoral care team can offer patients, their loved ones, and also KGH staff. I can't emphasise that enough, that chaplaincy are also here to support staff, not just around religious issues. We're also there to provide pastoral support for our staff, which some have found very beneficial in the past. So we can offer a listening ear in times of crisis or difficulty. We can offer space to talk about life and its meaning. We can explore spiritual or religious questions with the individual. We can help with breaking difficult news. We can support in practicing faith traditions. We can contact and signpost to other faith leaders or communities. And we can offer prayer support and pastoral counselling. We offer staff training and advice and help with the loss of a colleague or relative or friend. And we have in the past organised a number of memorial services for colleagues who have sadly passed away in service as a way of acknowledging their contribution to the work of the Trust and the teams in which they worked in. So my final slide is how to contact us. So we're usually in the hospital Monday to Friday, 8:30 to 4:30, and Sunday mornings from 8:30 a.m. to 1 o'clock. We have an office which is based near the main entrance, next to the multi-faith chapel near the shop. We can be contacted by telephone. Our extension number is 2609, and we also have, of course, an email address at KGH. At other times, or in an emergency, please call the switchboard to speak to the duty chaplain. So that ends my short presentation about spiritual and pastoral care services at Kettering. I do hope that you've enjoyed listening to what I've got to share with you today. And please contact us if you have any questions or indeed if you'd like any support in the work that you do. Thank you very much.